I really do appreciate the opportunity to speak to you all today. That bio was a little bit of a mouthful, but thank you for that wonderful introduction. So today I'm going to be talking to you ladies about your health care during the COVID-19 pandemic, and more importantly, your self-care during this time as well, because I know that can be really challenging. I'm not sure if I have the ability to share my screen? Do I have to be the host to do that? How do I do that?
1 second. I am getting ready to turn you to host. I'm letting some people in. Apologies. Okay, you should be the host now.
All right. So let's see if we can work this out. Can you all see these slides just fine? Okay, good. So like I said, we're going to be talking about healthcare and self-care during this pandemic and how this pandemic has affected these things. So first off, just some background about the COVID-19 virus. I think at this point in the year, a lot of people are really familiar with what it is, but we'll still talk about it. The COVID-19 virus is a virus that causes respiratory illness in humans, but we now know that it causes much more than just respiratory illness. We know that it also can affect the vasculature, which can cause things like COVID toes and diffuse inflammatory reactions throughout the body. So it can definitely cause more than just respiratory illness. Like the flu virus, I've gotten a lot of questions about why is this considered new when we've had coronaviruses present in the environment before. Like if you look on the back of the Lysol bottle, it'll say that this will kill 99% of viruses, including coronavirus. And that's a really good question. So just to clarify that a little bit, just like we have multiple strains of the flu virus, we've got the swine flu, we've got H1N1, and you got to get vaccinated against these different strains every year, similar to the coronavirus. So there's multiple different strains of it. So the family of coronaviruses have been around for very long time, and they cause things like the common cold. But this particular strain of the coronavirus is something that we've not seen before. It's something that we do believe started in animals and then got translated over to humans. And so it's a new virus for humans, which is why it's called the novel or new coronavirus. Uh-oh, 1 second. Bear with me, y'all. Okay, there we go. So how is this virus transmitted? So the virus is primarily transmitted through respiratory droplets. So that means when you cough, when you sneeze, when you're talking, there are particles that are coming out your mouth and your nose at all times. And so what we know with the virus is that those particles can tend to travel up to 6 feet. So that's where that social distancing recommendation of 6 feet comes into place, because that's how far we believe these particles can travel. So what are the symptoms? A lot of the symptoms of coronavirus are pretty similar to what you would see with the flu or a cold. So cough, fever, chills, muscle aches and pains, difficulty breathing, and sore throat. But some of the things that are a little bit different is the loss of taste, the loss of smell that we don't tend to see with the common cold or with the flu. And sometimes those respiratory symptoms can be much more severe than they would be with the cold or flu. So we know that certain populations of people are at higher risk of developing more severe disease. Some people can walk around with the COVID virus and be completely asymptomatic, while other people end up in the hospital on ventilators in the ICU. And so what we know is that high-risk individuals can have more severe disease. So that's typically going to be elderly people. And that's because, you know, as you age, you start to develop more chronic medical conditions. You may be on multiple medications. Some of those may affect your immune system and weaken it to make you more susceptible to severe disease. Those who already have pre-existing medical conditions, already have lung disease like asthma or COPD. Those with chronic kidney disease, those who have a weakened immune system, say from HIV or from cancers, things like that. Being overweight can also weaken your immune system, so that will put you at higher risk. And then heart disease and heart failure, those kinds of things, diabetes and sickle cell, all of those different medical conditions can put you at higher risk of developing severe disease. But another layer to that is we know that Black people, in addition to being at risk for severe disease, are actually dying at much higher rate than other populations, actually almost double the rate of Caucasians in the United States. So my home state is Missouri. I'm not sure where you all are, whether you're on the Kansas or the Missouri side, but my home state is Missouri. So I look at the Missouri data, and what we know is that African Americans make up about 12% of the population in Missouri, whereas Caucasians make up about 82% of the population. So even though Black people make up 12% of the population, they're accounting for 36% of deaths in the state of Missouri thus far from the coronavirus, even though they only make a very small subset of the population. And sorry, I'm having some issues changing my slides. Give me 1 second. Okay, what is going on? So part of this is probably due to pre-existing healthcare disparities that exist throughout the country, not just Missouri. It's not a problem unique to Missouri. It's throughout the country where we see Black people dying at higher rates and experiencing much more severe disease than other populations. And that's because, like I said, pre-existing medical healthcare disparities in the United States, African Americans having less access to healthcare, having higher risk of having those comorbid conditions and things like that, that are contributing to the higher risk of death and severe disease. So a lot of people have been weighing in about what you should do, what you shouldn't do. Comedians, in some cases you see politicians making this a very political thing when it's not. It should be based on science and healthcare. I did see this video probably a couple of months ago, and I thought it was a little amusing. So I'm going to go ahead and share this with you all. Let's see if we can get this to work. Let me know if you can hear it.
We hit the body with a tremendous, whether it's ultraviolet or just very powerful light. And I think you said that has him in check, but you're going to test it. And then I said, supposing you brought the light inside the body, which you can do either through the skin or in some other way. And I think you said you're going to test that too. Sounds interesting. Right, and then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? Because you see it gets on the lungs and it does a tremendous number on the lungs. So it'd be interesting to check that, so that you're going to have to use medical doctors with. But it sounds interesting to me.
So I don't know about you all. I thought that one was a little bit funny. I think the only thing that he did get right in that speech was that you need medical doctors to be making these decisions, and not politicians or people that have absolutely no experience or no idea what the science shows. But that's a perfect example of what you do not want to do. You don't want to be listening to people's opinions. You want to be listening to your doctors and people who are trained to deal with these situations and have some sort of medical knowledge about the facts. Definitely do not ingest any cleaners or disinfectants or anything like that. That is a recipe for disaster, and you just don't want to do it. So what can you do to help prevent the spread of this disease? So first off, social distancing. Like I said, we know those particles can travel for up to 6 feet. So you want to make sure you're social distancing and staying in situations where you can. So if you're at the grocery store or things like that in crowded places, make sure you're staying 6 feet. And if you're somewhere where you just absolutely cannot stay 6 feet away from people that you don't know, then you probably just shouldn't be there. You shouldn't be going to parties or crowded barbecues or pool parties or things like that because that is just a breeding ground for this virus. You want to make sure you cover your cough or your sneeze. That may sound like common sense, but sadly to say, more often than not, people are not adequately covering their cough or sneeze. So when you do cough or sneeze, it's important not to do so in your hand. You don't want to go like this. You want to make sure you're covering your mouth with the tissue or covering in the crease of your arm and throwing that tissue away right away and washing your hands afterward. Because as soon as you cough, you get that stuff on your hands and you start touching stuff and now you're spreading it all over. So that's very important. And then you want to be wearing your mask or your face covering when you're in public to help prevent the spread. You don't want to be touching your eyes, your nose, your mouth. These are called mucous membranes, and these mucous membranes are very susceptible to transmitting and absorbing the viral particles. So you want to avoid touching those areas. Objects that are frequently touched and frequently used, you want to be disinfecting these daily, if not multiple times during the day. So door handles, your car steering wheel, the panel in your car, I'm losing my words. When you flush the toilet, the lever that you flush the toilet, all of that stuff, all the stuff that you touch on a regular basis. Sometimes you don't think about how much you touch things, but you want to make sure you're cleaning up after yourself at all costs. And then if you feel sick, stay home, because we don't want your germs. Stay home. Use that as an opportunity to let husband or let your children step up and do some of those things that you would be doing. Have them make the grocery runs. Call into work if you need to, but stay home if you are not feeling well, and call ahead if you're not feeling well. Call your doctor's office. Don't just show up. Call them and see what the protocol is to make sure that you get tested without putting other people at risk. And then also making sure that you're washing your hands. So not just with water, we need soap, water, a really good lather, and vigorously rubbing those hands together for at least 20 seconds. All right, so as far as face coverings go, there have been a lot of studies recently about how effective face coverings are. So the cloth mask or the bandanas or any kind of face covering that covers the nose and the mouth. And so what the studies show, basically, almost unanimously, the studies show that these masks and face coverings are very effective at stopping the spread and transmission of the virus. So you can see here in the Petri dish on the left, this is someone who performed different activities without a face covering. And then on the right, we have this person doing the same activities with a face covering. And you can see that with sneezing, even with talking, even with singing, you can still transmit these particles just doing mundane everyday things, not just coughing or sneezing. Whereas when you wear that face mask, you really do prevent those viral particles from getting into the air. So this is another video that I saw I thought was pretty good, and I think he really does explain this pretty well. So we're going to see what Bill Nye has to say about face coverings.
Greetings, everyone. Bill Nye here. Why do people in the scientific community want you to wear a face mask when you're out in public? Well, please consider the following. Face masks like this one prevent particles from my respiratory system from getting into the air and then into your respiratory system. Blocking the movement of air is an old trick. Here's a scarf. It blocks the movement of air around my throat, helps keep me warm. This scarf won awards in the Washington State Fair for both design and workmanship. It can block the movement of air, but only to a certain extent. This is a homemade face mask. It has just 2 layers of cloth with a pipe cleaner sewn in to help it fit against the bridge of your nose. And it blocks the movement of air very effectively. If you're wearing one of these, you're protecting yourself and those around you. Here's an N95. These are made to block particles in the medical environment and when you're out mowing the lawn. This one's not sterilized, but it's pretty effective. So the reason we want you to wear a mask is to protect you, sure. But the main reason we want you to wear a mask is to protect me from you and the particles from your respiratory system from getting into my respiratory system. Everybody, this is a matter literally of life and death. And when I use the word literally, I mean literally a matter of life and death. So when you're out in public, please wear a mask. Thank you for joining me on Consider the Following.
Okay, so I don't know if y'all grew up on Bill Nye like I did, but I love Bill Nye, and I think he got this spot on, absolutely correct. The face mask really does protect it protects you, but more so it protects other people from you. That is the most important thing that the face mask does, protects other people from you. So when you're out and about wearing your face mask, you're protecting that person that's next to you and vice versa. So if you're in an environment and people are not wearing their face mask, they are not protecting you. Even though you have your mask on, if you're around people who are not also wearing face masks, all of their respiratory particles can still be getting on your clothes, can still be getting on things that you come in contact with and things that you touch. So you want to either excuse yourself from the situation or ask them to put their mask on. All right. So the do's and don'ts of the face covering, you want to make sure absolutely that you can breathe through it. That's number one. You want to make sure that you have one with you wherever you go. I know some of this stuff may be redundant. It's September, and I know we've been dealing with this for several months, but still it's good to reiterate. Make sure you have one wherever you go. Make sure it covers your nose and your mouth, and make sure that it stays clean because you've been talking, you've been doing activities throughout the day. So if you keep reusing that same face mask, those particles on the inside of the face mask, you're going to touch it probably, and then you're going to start to spread it. So make sure that you wash it and wash your hands after touching your face mask. You don't have to put face masks on itty bitty children who are not going to tolerate it and just frustrate them. You don't have to do that. And you want to try to avoid using surgical masks for things that are intended for healthcare workers. That was more so important when supply was very short. Now we do have more of a supply of PPE available, but still it's good to use things that aren't intended for healthcare workers. So what does all of this mean for my routine healthcare? So what about my mammogram, my colonoscopy, all those other things that I usually do and come to talk to my doctor about on a regular basis? So we'll start off by talking about mammogram. So just a word about mammograms. There's a lot of inconsistencies about the recommendations for breast cancer screening among medical societies. The vast majority of medical societies say at least by age 50, every woman should have gotten a mammogram. But in general, I would say at age 40, every woman should consider or at least have the conversation with her doctor about whether or not it's time to start screening for breast cancer. So at age 40, everyone should have the option, and insurance companies should cover a screening mammogram. But again, like I said, there are a lot of inconsistencies about those recommendations. But consistently, these organizations do agree that women over the age of 55 should be okay with screening for breast cancer every 2 years. Now, before that, between ages 40 and 55, there's some gray area there. But if you are an average risk female, if you don't have family history, personal history of breast cancer, you're not having any symptoms, and we'll talk about symptoms in just a bit too, then it is probably okay to get a mammogram every 2 years if you're not having those concerns or those symptoms and you just don't feel like you're comfortable going into the healthcare setting to get these screening tests done. I do want to be clear, I'm not advising women not to get their mammograms. What I'm recommending is that if you don't feel comfortable getting your mammogram during this time, and you have had a mammogram within the last year and a half or so, it should be okay for you to wait no more than 2 years if everything is fine, your risk factors have not changed, and you are not having any symptoms. So as far as symptoms of breast cancer, one of the main symptoms is going to be feeling a lump or a mass. So as far as a lump or the mass in the breast, breast cancer usually feels hard like a rock. When I'm doing my breast exams on my patients, I often go over how to do the self-breast exam at home, what to feel for. You want to make sure that when you're doing your breast exams at home, first off, you want to make sure you have your arm up in the air. That gives you more access to all of the breast tissue. You can feel all of the quadrants a little bit better when you have that arm up above your head. You want to make sure that you are going as high as your clavicle bone. I want everybody to take their hand and feel for that bone. Feel for your clavicle. You want to go as high as that bone there because the breast tissue does extend all the way up to the clavicle. It doesn't really matter exactly how you do it. Some people like to start at the nipple and kind of spiral out in a circular fashion. Some people like to start at the nipple and kind of go up and down and kind of spread around. Doesn't really matter. You just want to make sure you're hitting all the breast tissue. So high as the clavicle, arm up, you want to make sure you're going, excuse my sweaty pits, you want to make sure that you're going in the underarm and feeling there too, because you do have breast tissue that extends into the underarm. Then you also want to make sure that you are feeling under the nipple. So you need to take at least 2 fingers and kind of roll the nipple, feel under the nipple, because sometimes things can hide there. So let's recap. Hard like a rock, you want to go to the clavicle, feel all the tissue. Breast cancer typically starts out very small, so it may feel like a frozen pea or a frozen lima bean. The other thing about it is breast cancer tends to be fixed in place. So what that means is if you try to wiggle it around, it would feel like it's stuck, like it's not going anywhere. Most women, especially young women in their 40s and 50s, have dense breast tissue. So a lot of soft, lumpy, bumpy tissue that you may feel, all of that stuff is normal. You can wiggle it all over the place, but that hard like a rock fixed in place, that's concerning. Get your mammogram ASAP. Do not wait. Other things to look out for on the breast would be all of a sudden you have a rash on the breast. Came out of nowhere, you don't have a rash anywhere else, and you have absolutely no reason to have a rash. No irritant that you are aware of, no bug bites or anything like that that could have caused it. So just a random rash on the breast, that can also be a sign of early breast cancer. So you want to go in right away and get your mammogram. And then also nipple discharge. Unless you're pregnant, nipple discharge is not normal. There are some circumstances where we do consider nipple discharge normal in certain people. But again, if you have it, safest thing to do is just go see your doctor right away to be examined. All right, and then what about colonoscopy? So a word about colonoscopy. I don't know about anyone else. I'm still really shook up about the death of Chadwick Boseman. It really does. I felt very personal to me as a physician and as an African American. But nonetheless, I won't get on that soapbox. So as far as colonoscopies go, everyone, especially African Americans and Native Americans, should be getting colonoscopy by age 45. No exceptions. Regardless of your risk, the latest should be age 45. And if you have any additional risk factors, like someone in your family has colon cancer, you had a change in your bowel habits, blood in the stools, if you have any of those things, then you need to be screened much sooner than 45. But in the average population, that is the latest age which you should get screened. Colonoscopy is the gold standard for screening for colorectal cancer. So it's like the Cadillac or the Bentley screening therapy. But for the average risk person, again, if you just don't feel comfortable, you don't want to put yourself at risk, you've got elderly parents or immunocompromised people that you live with, and you don't want to have that extra layer of risk by going into the doctor, talk to your doctor about doing a stool study from home instead of a colonoscopy. Like I said, colonoscopy is the gold standard, but some stool studies in the average risk person can be effective ways of screening for colorectal cancers. Keeping in mind, though, that if that stool sample comes back abnormal, you will have to then get a colonoscopy. But if it is perfectly normal, everything looks fine, then most stool samples are every 3 years. So just something to keep in mind. Again, just talk to your doctor about what you think is going to be best for you. So what about pap smears? So we start screening. So the purpose of doing a pap smear is to screen for cervical cancer. So mammograms are for breast cancer, colonoscopy for colorectal cancers, and pap smears are to screen for cervical cancer. I have, so like my practice is primarily women, and oftentimes I notice that my patients get a little bit confused when it comes to pap smear screening and cervical cancer screening. A lot of times people think a speculum exam or a pelvic exam is synonymous with the pap smear, and it is not. So the speculum, I'm sure at this age, you all have probably seen a speculum before. It's that little duck beak device where they insert it and open it to look at the cervix, make sure everything's okay. A speculum exam is not synonymous with a pap smear. Speculum exams are usually part of a routine physical exam, like listening to the heart and lungs, looking in the ears, those kinds of things. The pap smear is the actual act of screening for cervical cancer. So that starts at age 21. For women under the age of 30, that occurs every 3 years if everything is normal. After the age of 30, women between the ages 30 and 65, pap smears can be conducted every 3 to 5 years, depending on your HPV status. Now, if you've had abnormal pap smears in the past, then you may need to get screened a little bit more frequently than that. But normal exams every 3 years under age 30, every 3 to 5 over age 30. All right, and what about other medical conditions? So you've got high blood pressure, diabetes, high cholesterol, having abnormal bleeding. I would say these are kind of more nuanced situations. If you just need routine things, you're on medications, you've done pretty well with them, nothing has changed, you can probably call your doctor's office and just ask for those refills or ask to have a virtual visit. Nowadays in healthcare, most healthcare systems are able to accommodate virtual visits where you can do it from the comfort of your own home without increasing your risk of exposure. So I would talk to your doctor about that. Now, if something changes, something is out of the ordinary, you feel a little bit funny, you're having more headaches or visual changes or things like that, go in and be seen. But if everything is copacetic, talk to your doctor, see if they can just shoot you some refills virtually. All right, so I don't know about y'all, but for me, it's been a tough year, personally, professionally, all around. It has been a tough year. I've had my plans, and then there was 2020. I was supposed to be, on a beach in Aruba somewhere right about now, but nonetheless, such is life, and such is 2020. So some days, I've definitely woken up. Let's see if I can get this to work, feeling like this. I know y'all, I don't know if we have any Set It Off fans in there or any Matthew McConaughey fans, but some days I've had these moments where, you just feel like, Lord, who did it and why? Like, what is going on? And then some days I felt like this, like, today's not the day. Don't mess with me, just be cool. And then this year has also been a year of reckoning. We've had a lot of racial tension in the country this year. It's been really tough. We've had a lot of unexpected deaths. And then this was another cute one that I saw. It says, I've almost completed my 90-day trial of 2020. How do I cancel? Like, Lord, just take it back. Let's just take it back to 2019 or fast forward to 2021. But through it all, we have to be patient. We have to have faith. We have to just remember that, this too shall pass. Your outlook right now should be in 2020. We should have the strength of this stool and the faith of this dog. Because like I said, this too shall pass and everything ultimately will be okay. So one of my personal mantras this year has been protecting my peace, just protecting my peace at all costs. All these things that are going on, it's just like, watching the news sometimes can just almost instantly provoke feelings of anxiety, depression, all kinds of things. When you constantly see these images in the media and all the violence and things like that are going on. So just my prayer for myself and for you all is that we learn how to protect our peace at all costs. And one of the things that I saw that I think I'm going to actually start to practice is a self-care calendar. So, that may look different for everybody, but you need to just map out your week or map out your month and say, what am I going to do every day this month to protect my peace and to practice good mental health and have good mental health hygiene? So it could be Monday, I'm going to get up early and exercise. Tuesday, I'm going to make some tacos just because I feel like it. Wednesday, I'm going to call my best friend up. Thursday, I'm going to call my grandma. Just having a mental health calendar, just take some time to yourself to have some self-reflection, to meditate, to exercise, to practice gratitude and say thank you. Whether it's thank you to God or thank you to someone or just being grateful for something that you experienced during the day or during the week. Because through it all, we all have lots of things to still be grateful for. One thing, and invest in yourself. Kind of just ties into everything else that we've already talked about. But one thing I've started to do is just try to carve out some quiet time in my day, most days, just to be with myself and just to reflect on some of the things that I'm thankful for. And so sometimes during my quiet time, I just look at these guys. I look at pictures. I take myself back to moments where I had happiness and pure joy. I think about the people that I love, the people that love me, and just kind of sit in those moments and reflect on those times. And it just kind of really helps to keep me grounded and just protect my peace and my serenity. So I just implore you all to do the same. It's going to look different for everybody, but just wanted to share what I've personally done. And that is that. I hope you all enjoyed it. I hope, if nothing else, it can incite some thought-provoking conversation.
Thank you so much for that. So we are going to have